Here in New York, more than 1 million residents are now fully vaccinated, but there are still many questions and fears about this virus. Here to answer them is Dr. Robert Tiballi, an infectious disease specialist with the Catholic Medical Association. And Dr. Tiballi, as you know, the CDC now says fully vaccinated people can skip quarantine if they've been exposed to someone with the virus. So how long after your second shot do you build full immunity, and can you then stop wearing your mask?
Well, that's very important to qualify exactly what quarantine means. And so after the first shot, about 30% of people get a significant boost in immunity. And then after the second shot, it's almost everyone has a very, very high and steep rise in immunity. The booster shot, very important. And so about 14 days after the second shot is when you have your maximum level of immune take or immunity developed by the vaccine. So what that means is at that point, until 4 months after you get the vaccine, if you're exposed to someone with COVID, that means you don't have to stay in your house for 10 to 14 days.
Okay.
That's what the quarantine means. It doesn't mean that you're immune from getting infection. You still have to wear your mask. You still have to do social distancing. You still have to do hand hygiene.
I want to ask you something quick, though, because you said up to 4 months. So what do you mean? After you get the 2 shots, up to 4 months, we don't really know what's going to happen after then?
Well, that's the last sentence in the CDC recommendation. So from 2 weeks after the vaccination for 4 months, because we know that immunity lasts for at least 4 months.
Wow.
From these messenger RNA vaccines, but we don't know how much longer immunity will last. That information will be available in the months to come, but it's a window,
Okay.
2 weeks to 4 months after the vaccine.
All right, some concerning news for parents from the CDC. It reports there are more than 2,000 cases of COVID-linked syndrome among children. It seems the number of cases are growing and they're more severe. What are your thoughts on that?
Well, this COVID-linked syndrome is actually the multi-system inflammatory syndrome that we were talking about earlier. Initially was most common among Hispanic and Black children. And it's very similar to something called Kawasaki's disease, almost indistinguishable in certain situations, but it can inflame the heart, inflame the blood vessels, cause organ issues, organ failure, respiratory failure. It's very serious. It's likely an immune response to the infection. And, we just don't know if the children that are getting them are having their first infection, their second, or their third infection with COVID, because many of them are asymptomatic. If this is a building immune issue, or if it's a strain-specific issue. But it is very concerning to parents all over the country, without question.
But it is still rare, even though the numbers are growing, right?
Still rare.
Okay.
Very rare,
All right.
even though the numbers are growing.
All right, right now the vaccines are only for people over the age of 16. Why is that, and will children eventually have to get the shot as well?
Well, they're trying to recruit children into studies right now. The initial studies did not include children, and that was because children seem to not have serious illness with a disease. And so they wanted to study as many people that would benefit mostly from the vaccine. So they're trying to recruit children into the vaccine studies now, and the vaccine manufacturers are having a great difficulty in getting children enrolled in the studies.
Interesting. All right, always good to get answers from Dr. Robert Tiballi of the Catholic Medical Association. Good to see you.
Thank you.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.